Welcome. In this series of videos, we'll discuss weight-related bias and stigma. We'll define these terms and think about how they contribute to negative stereotypes and discrimination for individuals with larger bodies. We'll reflect on examples of weight-based bias and stigmatization in the media, clinical practice, and our everyday experiences. We'll also discuss how experiences of weight-based stigmatization and discrimination can lead to negative psychological and physical health outcomes. We have 3 learning objectives for this topic. The first is to define the terms weight-related bias and weight-related stigma. The second is to distinguish between explicit weight bias and implicit weight bias. The third is to outline the prevalence and consequences of weight-related bias and stigma in health-related research and clinical practice. In this first video, you'll learn the definitions of the terms weight-related bias and weight-related stigma. Before I discuss these terms, I first want you to reflect for a moment. Think about how individuals with larger bodies are typically portrayed and regarded in our society. What have you seen in the media or in your personal life? Perhaps some of what you reflected on were images of individuals with larger bodies that were portrayed in negative or demeaning ways. We often see this in the media, where we see stock photos and videos of headless, larger bodies that are dehumanizing for individuals with larger bodies. We also see stock photos and videos of individuals with larger bodies who are doing things deemed as unhealthy, such as eating junk food or watching TV. We also often see that actors or actresses with larger bodies are limited to roles that are unflattering. They're less likely to be the star or the starring role, especially if there's a romantic storyline. In clinical practice, we see that individuals with larger bodies are assumed to have unhealthy lifestyles and sometimes are not assessed as thoroughly as individuals with smaller bodies because clinicians make these assumptions. In addition, practitioners may attribute health conditions, even ones that aren't weight-related, to an individual's weight. There are also instances of practitioners failing to ensure that exam rooms are equipped to make larger bodies comfortable, for example, having larger gowns or scales that have large capacities. In everyday life, we see these examples as well. There may be staff at restaurants or on airplanes who negatively judge customers who need larger seats or seatbelt extenders. We may also see workplace microaggressions that limit opportunities for advancement and growth for individuals with larger bodies. And sometimes our public health interventions, although well-intentioned, may inadvertently make things worse. For example, you've probably heard the message, eat less, move more. This is usually not the simple solution to obesity. In fact, this message is overly simplistic, and it implies that personal responsibility is solely responsible for individuals' weight status. It doesn't appreciate that there are strong genetic and biological factors that can determine an individual's body shape and size, regardless of how much they exercise and how little they eat. So merely implying that individuals need to eat less and move more to shape their weight can be insensitive and unhelpful. The quote on this slide is a nice illustration of this argument. This comes from a recent opinion piece from some of the lead researchers in the field of obesity treatment. Within this opinion piece, they argued that we need to consider both biological as well as behavioral influences, and that biological adaptations are an important contributor to obesity and may limit the effectiveness of our lifestyle interventions. One exemplar quote from this article states, "Once obesity is established, body weight seems to become biologically stamped in and defended. The mere recommendation to avoid calorically dense foods might be no more effective for the typical patient seeking weight reduction than a recommendation to avoid sharp objects for someone bleeding profusely." When it comes to weight, we have to recognize the limits of biology and that sometimes our recommendations fall flat and end up being stigmatizing because they focus on behavior when there are strong biological influences as well. So we have to be more inclusive in our thinking to make sure that we're not making things worse by making assumptions that might be harmful. So these are just some examples of weight-related bias and stigma. You may have thought of others, and we'll continue to talk about more in these series of lectures. So let's define these terms. What is weight-related bias? This is defined as negative weight-related attitudes, beliefs, assumptions, and judgments toward individuals based on their body shape and size. Should be noted that this can go in either direction. Individuals with small, thin bodies can experience weight-related bias, as well as individuals with larger bodies. We'll focus more on individuals with larger bodies who feel the experiences of these biases and the impacts of these experiences. What is weight-related stigma? This stigma is the result of weight-related bias. It's defined as negative social devaluation of people because of their body shape or size, and it's the precursor to weight-based stereotypes and discrimination. So again, this can be experienced by people with smaller or bigger bodies, but at its core, it's the experience of being stigmatized because of your body. And one thing that we see is that bias and stigma perpetuates further bias and stigma. The examples that we discussed earlier are rooted in weight bias and stigma, and they reinforce harmful stereotypes, exclusionary environments, and discrimination of individuals with larger bodies. This reinforces the ideas that underlie these weight biases and weight stigma. And thus, recognizing the cyclic nature of weight bias and stigma is the first step in disrupting this cycle. Obesity stereotypes matter. As we'll discuss, weight bias and stigma are the mechanisms linking obesity to adverse psychological outcomes, such as low self-esteem, weight bias internalization, and depression. So let's review some key takeaways from this video. First, individuals with larger bodies are often portrayed and regarded in ways that are negative and demeaning. You may have thought of some examples you've seen. We discuss many examples that are commonly seen in media, clinical practice, and everyday life. And as you reflect on this video, you can continue to be aware of these examples of stigma and bias that are in your everyday experiences. It's also important to recognize that these messages reinforce weight-related bias and stigma. Weight-related bias really encompasses the negative weight-related attitudes, beliefs, assumptions, and judgments that we hold towards individuals based on their body shape or size. Whereas weight-related stigma is the result of this weight bias and is the negative devaluation of people because of their body shape or size. Both weight-related bias and weight-related stigma have negative impacts on both psychological and physical health. And recognizing our own weight-related biases and ways that we might either inadvertently or advertently stigmatize individuals because of their weight is an important first step towards combating these issues in health-related research and practice. That's all for this video. Thank you for learning with me.